Welcome back to Coronavirus, Your Good Questions. We're joined again by Dr. Anthony Pisani, Associate Professor of Psychiatry and Pediatrics at the University of Rochester. I want to talk a little bit about the fear or anxiety that kids might be having about the crisis itself. And why don't we start with the grade school kids? While they might understand everything that's going on, what are some good ways to answer their questions or talk to them about why their routine has changed?
Right. Yeah, there are a lot of concerns about that, and they're real, right? People will get sick. They are, and there is danger. I think here it's really important to also balance those with the kinds of stories of recovery. I mean, the fact is that across ages, it's something about 97% of people do recover from COVID illness, and now that might be a little bit less for older adults, but there have been very few pediatric cases. So I think there's also important to reassure kids that this is really serious. You're doing something important by staying home, and it is serious, but we're taking the steps to keep you safe. And a lot of people are doing a lot of things to help this. I think that would probably be the most important message for young kids and for teenagers, really, is that we're not just sort of sitting here helpless. There are people across the country and across the world who are engaging in incredible innovation right now to try to find vaccines, take treatments, adjust our lifestyle so that we have, both healthy, safe, and enriched lives. So I would say that the biggest concern would be this: if kids had the sense that we're just sort of helplessly waiting for this virus to get us. It's not the case.
Yeah. What about the older kids? They may have had some of their significant life events impacted. Schools, obviously, proms, graduations. Maybe they see their parents out of work or grandparent that passed away. How do you help them to stay positive?
Yeah. I think there's a number of things. One is that we do have to be honest with teenagers that this is hard. And I think especially around the economic consequences, they're going to know. So we might as well be straight up with them, and kids usually appreciate that. I think other things are that, to put their sacrifice in that context of generosity. That this is not something that's just meaningless. 80% of Americans support these measures and feel they can keep doing this for at least another month, and so that we're part of something where we're making a difference. I think that can be part of it. And the other thing is add. Wherever there's been subtraction, so where can we add? Are there new things that they can take up? I know one family where one of the kids is trying to learn to be ambidextrous. So she's doing everything with her non-dominant hand, and kind of a distraction. But what things can we add where there's been subtraction? Acknowledge it. Don't try to pretend it's no big deal that you're not having your graduation. But also presenting this as, this adversity presents opportunity. And I think that can be a help. I think finally also we really need to acknowledge where we're having a hard time. I worry most about where parents are themselves struggling, which is very understandable. This is unprecedented economic hardships. There's loss. And I think for parents to know people are doing things, that's helpful. And, there's also a ton of innovation going on in the delivery of mental health services. And so if parents are feeling super stretched to the point where they feel like they might be not even sort of able to be helpful to their kids, to be able to be positive and there for them. Well, I know at the University of Rochester Medical Center, it's been an extraordinary transformation towards telehealth, being able to offer the same level of services that we've offered, but over telephone or video. So it's not that because we're at home means it can't get help. That is available for us. And I think if we can, be strong and get strong, then we can then be there better for our kids. I think we got to be, gentle with ourselves if we are struggling. Try to see where we can help each other, and when it's time, know that there are people there.
This is such an important topic as we navigate our way through this pandemic. Dr. Anthony Pisani, we really do appreciate you joining us tonight. Thank you so much for all your insight and your expertise. Coronavirus, Your Good Questions continues tomorrow with Dr. Emil Lesho. He's an infectious disease expert with Rochester Regional Health. If you have a question for him, send it to goodquestion@whec.com.